Hi, welcome to the Caring Hands 2023 Town Hall. We are so excited to have you listen in on what we all did in 2022 and what the future of Caring Hands looks like. So, you might be asking yourself, what is a town hall and what is the purpose of one? A town hall is a great opportunity for the whole team to come together and share any exciting news that's coming in the future, any challenges or new ideas that need to be shared. Also, it's always great to meet the team that you're working with. A lot of the time, we only speak to you all on the phone, so it's awesome for you to know your administrative staff and then for us to meet our field staff. To start off, we're going to do an admin staff meet and greet. First up is no other than Rochelle Wilkins, our owner and administrator. A lot of you probably have met her or seen her on TV, but she is the founder of Caring Hands. She started Caring Hands in 2001 with a vision and a dream. Our mission here is to service the triad and provide the best one-to-one care. Not only that, we want to provide enrichment to our clients' lives, and that's where you all come into play. And we're eternally grateful for the staff that we have, because without you guys, we're not able to service this community. This next slide shows a few other team members, starting off with Cheryl Leonard. She is our agency director. She is someone that you can go to if you have any questions about the overall business or any high-level concerns. Next is Latoya Van. She is our scheduling supervisor. Her and Jasmine Gant work together to get you all schedules, address any client problems, or if you need a schedule adjustment or need to report anything to the office, typically you would talk to them. Next up is Crystal Tejada. She is part of your HR team. She's your HR manager. Her and Monet Campbell work together to do exciting things like employee engagement, find new people, host orientation, and also if you have any employee concerns, the HR team would be who you would go to for that. Elizabeth Myers is our primary nurse. If you need any assistance with updating or adding anything to a client's care plan, you would contact her. CNA renewals, she also would be the one to go to about any trainings that we have available in terms of Med-Aid training and so on and so forth. Stephanie Williams is your quality field supervisor and trainer. Miss Stephanie is a part of the new hire orientations and doing your skills checks. She also goes out to the client's home to do quality visits. So she'll go in and make sure that the client's doing okay, that the employee is satisfied, and is also there in uniform following policies. But Miss Stephanie also does refresher trainings and CPR training. So if you're looking to get your skills up or have any questions about what to do in the client's home, Miss Stephanie would be a really good resource. On the next slide, we have some more lovely faces. Again, Jasmine Gant is part of the scheduling team. She helps Miss Latoya with the schedules, and she's always there if you need or have any questions about your scheduling needs. Next up is Fran McMeekin. She is the client liaison. So her job is to go out and find the clients that you're servicing. So a lot of the times you can find Fran in assisted livings, hospitals, locations like that, sharing with the people about the services that Caring Hands provides. So Miss Fran is really appreciative and looks to you all in terms of the things that you should be doing in the client's home. She sells the heck out of Caring Hands, so she's very grateful and appreciative to have an awesome field staff like you all. Next, we have Gerard Harrison. He is our social media coordinator. So a lot of the times when you're on social media and you see our flyers or any awesome videos, he's the one behind that. Also, he runs our social medias. So whenever you message in or have any questions, he's the one replying. So that's what his role is. Next is Monet Campbell. She is a part of the HR team, so she works with Crystal to go out there and find the talent. So if you guys have any friends or family or anyone that you know of that is interested in home health and wants to start in the healthcare field, Monet would be a great resource. She also does employee engagement. So every month she's assisting in creating those fun events. She goes out and does spotlights, employee of the month, things like that. Last but not least, we have Miss Jasmine Cummings, and she also is a client liaison. So her and Fran work together to find the clients that we're servicing. And again, they're out there selling the services that we provide and selling your skills. So they speak very, very highly of Caring Hands and of you all. Many of you probably know the type of client that you service, whether it's a CAP client or it's a VA client, or maybe you've heard scheduling talk about the different types of clients when they're offering you shifts, but we want to take the time to kind of break it down and explain a little bit further. So the first type of client we're going to look at is under managed care. So those are the clients that have Medicaid but are under the age of 65. Some of the types of insurance that are under managed care could be Blue Cross Blue Shield, United Healthcare, AmeriHealthcare, and WellCare. So that encompasses a large amount of the clients that we have. But then also we have PCS, which stands for Personal Care Service. And those are the clients that have Medicaid but are over the age of 65. So those are clients that need assistance with basic ADLs, and that could be companionship, medication reminders, light housekeepings, and things like that. Next, we have CAP, which is broken up into two. So you have the children, and then you have the disabled adults section. So we do service children and adults. So for CAP-DA, that's disabled adults. So those are people that are born with either mental or physical disabilities. And services that are covered, of course, are personal care services, going out into the community, maybe some light housekeeping, and some other tasks that you're probably familiar with. Next, we have DSS. So that's the Department of Social Services. So this is provided to people who have eligibility for PCS but have maxed out those services. And same thing, a lot of the tasks that you'll be doing with these clients are light housekeeping, companionship, maybe medication reminders, things like that. Next up, we have VA. So those are our veterans. And essentially, they provide a lot of the time the same kind of care as what they're needed. It's just covered under the VA. Next up, we have PACE of the Triad. So PACE is a little bit different. PACE does cover home health services, but a lot of the times those are the clients that are going to the day program. So you might see them in the morning before they go off to PACE, help them get dressed, any light meal preparations, housekeeping, or you could see them when they get back from the PACE facility. For those type of clients, of course, you don't go to PACE with them. You just service them in between when they're not at the day program. Last but not least, we have private pay and long-term care insurance, which fall under the same kind of sector. So those are people that are paying out of pocket for very similar services like everyone else. So it might include ADLs, maybe organizing, or maybe those might be clients that need more extensive care, total care, end-of-life care, things like that. So that overall are the different types of clients that we service. So you've learned about the different clients that we have. Now, how we get those clients, for the past 20 years, Caring Hands has been using different streams of communication to get them. So you probably have seen our TV commercials and our updated ones that recently just went out. We also have been investing in billboards, so there's different locations in Greensboro that we have some. Of course, we have a big use of social media now, radio commercials, Indeed, and word of mouth is pretty big too. So we ask you guys as caregivers, if you know anyone that needs services, maybe it's a family member or a friend of a friend, same thing about employment. We have a referral bonus that you guys can benefit from if you refer a friend and they work up to a certain amount of hours and days. We ask you guys to get the word out. There's 150 of you all, so if you all share the word about Caring Hands, I'm sure we could get a great turnout. Moving on, we're going to talk about some policies and procedures. So there's a lot of them regarding to clocking in, attendance, that you're probably familiar with what it is you're supposed to do. I just want to talk a little bit about the why, so the reasoning behind a lot of the policies that we have. The first one is clocking in and out. We ask you guys to use your WellSky app or use telephony if you're not able to. And the reason behind that is, well, one, it helps us keep tracking of who punches in, who punches out. So when we're billing out these things to insurance or even those private pay clients, we can show the time that you worked. Not only that, but it helps us remain in compliance with EVV. Moving on to your attendance, we ask that you keep your callouts to a minimum. And if you do have any callouts or you're running late, we ask that you communicate that with the office. Same thing about leaving early and coming in late. We ask that you stay for the whole shift. And a lot of that reasoning is, one, you're accountable for your time. And not only that, when you cut the hours short, when you're coming in late and leaving early, it can affect the amount of hours that your client might be authorized to have. And not only that, it helps you because it's a consistent income. If you work the hours you're scheduled, you'll always know how much you're going to be paid out and it won't be skimmed out. Next one is personal business. So we ask you all to have professional conversations and not tell the client too much about your personal business. The first reason is, well, the client can use it against you. A lot of the times you go into the homes and get really close to the clients, tell them all of your business, and then they turn around and call us as soon as there's an issue and tells us everything that you've told them. But outside of that, also, it's a professional relationship that you have with your client ultimately. So you want to remain within that scope of the relationship and protect your business. Next one is working off the clock. So that goes along with personal business, and that's going extra mile for the client or doing things for the client when you're not scheduled to. So maybe the client asks you to go to the store for them, or you check in on them on your days off, things like that. The reason we ask you not to do that is, one, because it's not covered under insurance, so you're not paid to do those things. Sometimes, unfortunately, your client can take advantage of that. If you go to the store for them one day, they'll expect it every single time. And when you don't do it, they'll get really upset with you. And not only that, maybe you're not servicing that client anymore and they expect that same thing out of another caregiver when we've told them that's against policy. So it just helps with consistency and making sure that the client understands that every single caregiver is going to follow a set of rules. Next one is bringing guests to work. So that includes not bringing children or any outside guests, or even sharing the address of a client to other people. Bottom line, that's about safety. So anytime that you have extra people in the home, someone could get hurt in the home. If you share the address, someone else can have that information and maybe can come to the client's home when you're not there. So it's just a privacy violation. It violates HIPAA and it's distracting and can cause accidents in the house. Next is eating the client's food. We ask that you bring your own food. So let's say you're there for a really long shift and you have some time to sit down and have lunch with the client. Instead of accepting the food that they offer you, just bring your own lunch. And honestly, you don't know how long that food has been there. Sometimes the client doesn't have enough to share. They're just sharing out of being polite. And you could be allergic to something that's in the food that they didn't tell you. So it's always just good practice. Bring your own food and decline the food that they offer you. Also, you shouldn't be going into the refrigerator of the client or their pantry and raiding their snacks. Just bring your own food and drinks so that you don't have to take from the client. On the next slide are just some few more policies. So cell phones. We ask that you only use your cell phones in the client's home when you're clocking in, clocking out, or recording any tasks or comments. The whole cell phone thing is for a few things. When you're on your phone, there's no way that you're able to provide good service because you're distracted. Now, we totally understand that you have families and lives outside of work, but you shouldn't be taking personal calls in an excessive manner or texting, playing Candy Crush, whatever it is that you do on your phone. And we ask of that because it removes a distraction and it's professional and a courtesy to your client. Next one is your dress code or your appearance. We ask that you come to work in scrub tops and scrub bottoms, closed-toed shoes, have your badge, smelling good, looking good. Not only is that a representation of caring hands, but it represents you. You want to make sure that you're looking professional and safe with your appropriate attire. Last policy that I want to talk about is sleeping while on the clock. That one is pretty self-explanatory. If you're sleeping, there's no way that you're being attentive or having good customer service to the client, but also it's not safe. Even if you're asleep for 10 minutes, anything could happen to your client. So it's important that you're up, you're awake, and if you're falling asleep, bring a book, engage with the client. We have activities in the office that you can always do. But even if the client says it's okay, you should definitely not be sleeping while on the job. Now, we talked about some of the things you're not supposed to do. Here are some of the things that we encourage you all to do while on your shift with the client. Like I said, we do have activities in the office that you can come and pick up. But if the client has any puzzles, board games, or they just want to listen to music, maybe coloring books, painting, things like that. A part of why we're there, yes, is to provide personal care services. But two, you want to make sure that you're providing enrichment and companionship. So that's some of the things that you can do. We ask that you, of course, follow your care plan and check off your tasks. If there's anything on the care plan that you feel like needs to be added or you have any questions about, Elizabeth, our director of nursing, would be a really good person to reach out to because she can get that done for you. We ask that you're on time and communicate any schedule changes with appropriate notice. So we ask for at least 4 hours. And all you have to do is call the office and speak to scheduling. We ask, of course, that you're in your uniforms and ultimately just follow policies and procedures. If there's any incidents or accidents in the home, please do report it to the main office. If there's a life-threatening emergency, you can go ahead and call 911 or whoever needs to be called. But right after, just report it to us. So this next slide talks about employee appreciation and how we like to give back to our caregivers. Something that we are very, very adamant about is saying thank you, because ultimately without our caregivers, we would not be able to service this community. So something we've been working on since 2022 is developing our employee recognition and awards program. In this slide, you can see a few pictures of employees that have received Employee of the Month awards, Spotlight awards, and then every single month we do a different event in the office. So your engagement. Sometimes we're feeding you, sometimes we're doing a raffle or just doing spin the wheel with prizes on the board. But either way, it is our way of saying thank you. So some of the ways that you can be recognized to receive a Spotlight award or Employee of the Month can be, of course, being to work on time, not being late, and ultimately just providing really good service. A lot of the time, the client or the family member will call into the office and let us know that they love their caregiver and that you've been doing a really good job. Or the scheduling department does a really good job of notating who gets compliments and who's always going to work and picking up extra shifts. So all that is just a way for us to say thank you and give back to you all throughout the year. If you're ever interested in what's going on in the office on a monthly basis, please check your emails and text messages, because that's how HR is going to send out deets about the monthly engagement. This next slide talks about community events. So last year we were part of the Greensboro Christmas Parade. We even had a health fair, which we will be doing again May 19th. So if you're ever interested in participating in things like that, please reach out through our email. You can email us at hr@caringhandshhc.org. We were also a part of the Alzheimer's Walk. So if you're interested in anything like that, shoot us an email. This next section kind of focuses on the future of Caring Hands. You guys probably noticed we did change our logo. So on the screen from 2001 to 2022, we had the original Caring Hands logo, and now we went forward and did a refresh look. Sometimes when you've been in the game for a really long time, you have to switch it up and make sure that you're still showing something new to the community. So that is our new logo on the screen. This next slide, if you guys can go ahead and click on the screen, you'll see our recap video for 2022, and that just has a bunch of awesome content when it comes to the engagement we did. You'll see the Christmas parade, you'll see the Christmas party we did, and also learn a little bit about the things we did. So this last slide talks about the future of Caring Hands. There's a lot of excited changes coming over the summer. So the first thing is we're getting a new payroll system in July, and it's called Paychecks. Very similar to Paylocity, but that's where you're going to see things like your check stubs, employee information, things like that. And don't worry, we're going to have many, many, many informational sections to make sure that all of you are involved in the process and know how to use the system. Also in July, we are getting healthcare benefits. So again, we will no longer be using AFLAC, which is what we have been using in the past, but we'll also update you with that, sending informational flyers and having sessions in the office for you to come in and ask questions about how that affects you. But it's a good thing overall. On top of that, we're also looking to expand Caring Hands throughout North Carolina. Right now, we service 7 different counties in the Triad, so our hope is that we're able to expand the services that are very much needed in the community. We're also going to be expanding and adding a new employee portal to the website. That's where you're going to be able to access anything like any merchandise that we're selling, employee flyers, or any policies and procedures that affect you all directly. Last but not least, we're going to be rolling out a new elite program. So this program is meant to elevate all of you all that are part of Caring Hands. So there will be different tiers and there will be different trainings that you're required to take. So for example, you could be a level 1, 2, or 3. And as you progress through the tiers, of course, a pay increase will come with that. We hear you guys that you want to know where you're going with Caring Hands. You want to know about raises, and that's exactly what the elite program will do. It will elevate your skills, and not only that, it will give you a pathway for your journey with Caring Hands. So just know that the future is super, super bright, and we have many things in store for you all. You've made it to the end of the town hall, and we just want to thank you again for taking the time to listen. And if you have any questions about the information that was shared, again, you can email us or give us a call in the office. Thank you very much.